Endocarditis. Introduction. Which one of the following statements is true about the endocardium? Choose one of the following options. 1. It lines the 4 chambers of the heart. 2. It covers the valves in the heart. 3. It is of the same type of tissue that makes the inner lining of blood vessels. 4. All of the above. Correct. People with heart abnormalities are at an increased risk of developing endocarditis. Select true or false. Correct. Because germs attach to the abnormal areas, people with certain heart problems are at higher risk of getting endocarditis. How can bacteria enter the bloodstream to cause endocarditis? Choose one of the following options. 1. From having certain dental procedures. 2. From infections in other parts of the body. 3. Through a catheter inserted through the skin. 4. All of the above. Correct. Bacteria can enter the bloodstream in many ways. Usually, the immune system will kill germs in the bloodstream. However, if a person's heart has a rough lining or abnormal valves, the germs can attach and multiply in the heart. The symptoms of endocarditis are the same in everyone. Select true or false. Correct. Not everyone experiences the same signs and symptoms. Symptoms depend on the type of infection causing it, if the infection develops quickly or over time, and if there is an underlying heart condition. Infections of the endocardium can spread outside the heart. Select true or false. Correct. Endocarditis can cause complications that affect the heart, brain, lungs, and other organs. Antibiotics are the main treatment for endocarditis. Select true or false. Correct. Antibiotics are usually given for 2 to 6 weeks through an IV to treat endocarditis.
Thank you for using Explain.